Well, firstly, can I just say thank you so much for coming out here this afternoon. We're obviously at the Orewa Surf Lifesaving Club. That's because Mark and I have been meeting with them today, and we just so wanted to come by and say thank you for all the great work that they do for us over summer. So that's why you're here. So I really appreciate you coming out just to talk with us here. I want to just pass a few remarks about the Prime Minister's statement this afternoon, and then we can get into some questions with you if that's easier. I guess my big takeaway is that things have been, the reality is that things have been very slow, and as a result, we aren't prepared for where we need to be. And the takeaway is very simple. When you look at the situation around vaccines, we've been slow on rollout, we've been slow on vaccine boosters. We're the fourth and lowest in the world in terms of developed countries. We've only had 60% of eligible vaccine boosters actually in place and actually haven't taken them up. We've been slow on ICU beds. We don't have a single extra ICU bed. We've only got 108 available if we ever need them, and we hope we don't, but we should be prepared for that. And when you start to look at boosters and other rollouts, we've been incredibly slow. Rapid antigen testing is a big problem for us in this country, because once Omicron takes hold, our testing will be overwhelmed, and we need to be able to make rapid antigen tests available. And the reality is, with 4.6 million only in the country, that's less than one per person. We need tens of millions of them. And the government has been, companies have been reaching out to them for a long time, and now we're in a place where we actually don't have what we fundamentally need. So whichever way you look at it, it is disappointing. It's been a very slow response, and I think we are unprepared. But the reality is we are now where we are, and we now need to focus on the actions that we need to take to actually make sure the country is as prepared as it possibly can be. And there's two things. The first is to protect the vulnerable. That means all of us going out and getting our boosters as quickly as possible. It means focusing on our seniors and our over 50s in particular, where there's higher levels of risk. It means certainly working with our vulnerable communities. We want to make sure we are partnering deeply with Whānau Ora and actually getting out there into the communities and working with them. And we need to be able to encourage parents to be able to, once they give their consent, to get their children vaccinated as quickly as we can as well. And ideally, to be able to do that through a school system, like we used to be able to do vaccinations, would I think be a very good thing. The second thing is then we need to put our defences into place very quickly, and that means securing rapid antigen tests. And we know there are companies that have been talking to the government, but they've been rebuffed. We need to scramble, we need to secure those tests and get them here as quickly as possible. The second thing is we need to be very much focused on how we actually make sure we get the ICU beds in place that we want to do. And we also need to make sure we've got the treatment drugs here, not just talking about it, but actually here. Have we actually placed the orders? More importantly, is the supply here? Have the approvals been done? Is the supply in place or not? And the final thing is I think there's a lot of work around getting really clear on the protocols going forward as to what we expect. Little things like what happens when a whole workforce of truck drivers gets taken out? How will we handle that? What are we going to do about home isolation and how people escalate to hospitals when they need that? What does it mean for close contacts, for example? If you're in a home, you're isolating for 14 days and your close contact in that household has another 10 days on top of that, it's 24 days in total. So just some of those things we need to be clear, but if we can get our defences in place, rapid antigen testing, ICU beds, protocols really clearly stated, drugs here that we might need for treatment, that helps us at the other end of this as well. So I just encourage everybody, get out there, get vaccinated, get your boosters done, do it as quickly as you possibly can, and now let's get the government focused and moving from talking to doing, and that's really important here. And with that, happy to take any questions you may have.
94% vaccination, is this not relatively well placed to face Omicron?
Yeah, look, 94% double vaccination is really good, and there's lots of good countries and models around the world where we've had high levels of vaccination. We know how Omicron works, that it actually is highly contagious, and the severity of it we suspect is less, and vaccinations are important for giving each individual protection. They may be less important as we deal with transmission as we go forward. And so the answer, though, is about our booster shots. We already have people who are eligible for boosters 4 months after they've had their second shot, and we've only got 60% of them having taken it up. So we really need to have a big focus on that, because as I said, that's the fourth worst in the developed countries in terms of our booster rollout program. So that's one thing we can do. And the other things, as I said, rapid antigen testing, I'm extremely concerned about. I can go to any supermarket in many other countries around the world and they are freely available. And as a result, there are companies that have been talking to the government over the last 9 months who have been rebuffed. And now we've got to go scramble and try and get those orders here as quickly as we can.
What do you make of the three-phase approach the government's kind of rolled out as a response response to Omicron. What do you think about that?
Well, look, I think the challenge I've got with the whole framework is just the logic behind it and the criteria behind it. I think it's got highly confusing for New Zealanders. We've gone from alert level systems to steps to traffic lights to tweaked traffic lights. And fundamentally, the real challenge we have now is actually just two things. How do we actually protect our most vulnerable, and how do we put our defences into place? And most importantly, how do we make sure each and every day we're not just talking about it's coming, we're going to do it, it's actually done. And there's a big difference between PR, spinning and words versus action, delivery, getting it done. And that's what I really want us all focused on. Every day at 4 o'clock, I would be calling a chair of a DHB to say, how many extra staffed ICU beds do we have today? Sure. How many have we actually got those treatment drugs approved? What's holding them up? They're approved in other countries. Why can't we get them here? Why is it only 60% of eligible people for boosters have actually got it done? So there's a difference between talking about things and getting things done. And this is the big problem with the government, is that we are now where we are, and it is a reality of this is what's happening and this is what's about to happen. But we need to get very, very focused on delivery, getting things done and execution.
Some epidemiologists pushing for tighter restrictions to kind of control the outbreak of Omicron specifically. What did you make of those requests? Do you agree with that?
Well, look, I mean, anything that helps slow it down and can help us get prepared. We're only having to do that because, as I said, the defences aren't in place and we haven't been protecting the vulnerable as well as we could have been. But the reality is, when you look all around the world, ultimately, this thing is going to go across our community. And so what I'm more fixated on is fundamentally, how do you solve that problem? How do you prepare the country? I used to run an airline, and we used to think very deeply about risk management, and we would have multiple redundancies in place, and the same thing needs to happen here. So look, I'm just fixated on this is where we are right now, and what we need is protect the vulnerable, put our defences in place, but most importantly, stop talking and start doing.
Does it do that? Do we need more restrictions in place to slow the spread, as Professor Michael Baker said?
Well, look, I think reluctantly the things that we're talking about masking, social distancing, gathering limits, those are practical, pragmatic things. But we're doing them, frankly, because we don't have a healthcare system that's prepared. We don't have the drugs. We don't have the booster rollouts as we have and needed to have for this. And yet, the great advantage of New Zealand, frankly, is that we're one of the last countries by which COVID developments hit. We have lots of time as fast followers to learn from other countries, and we know where this goes, and we know the pattern of this. So, we should be the best prepared of any people on earth, and at the moment we're not. Sorry.
Do you agree in principle, though, with the decision to move New Zealand to red tonight?
Look, reluctantly we would agree with that position, but I would want a pathway very clearly for what it takes to get us back to orange. But what I'd say to you is, I've got a bigger issue with the logic or the construct behind the system. I'm not clear what takes the criteria for going up or down or in and out of these different colours. What I'm more fixated on, frankly, is action. Things need to happen, and that's a different skill set. You can talk about it, you can communicate it, you can spin it, you can PR it, but bottom line, you have to get things done for the New Zealand people.
Would you do anything differently, though, in terms of gathering sizes or limits for different settings?
Oh, look, I think that's about taking the public health advice, and that's very clear. And, if that's the best advice from our experts, we need to respect and follow that. But I can tell you what we would do very differently is we'd be picking up the phone and making sure the things we're talking about are actually happening. Rapid antigen testing, we've been talking about it for 9 to 10 months. It's not just a topic we like talking about. The reason we do it is so that it's actually here, we've got stockpiles of it, and we can actually use it. We need tens of millions of kits. We've got 4.6 million. It's less than one per New Zealander, and we're going to need multiples of that. But now that's been around for 10 months, and nothing has happened. So we talk about it, it's coming. Oh, we might have a few here. Oh, yes, if you're unvaccinated, you can get some through pharmacies. But we don't have widespread distribution of multiple kits available freely to many, many people. And so other countries do. I can walk into supermarkets all around the world and buy a rapid antigen testing. Businesses that want to use them with their employees, they can do that today. They can't do that here in New Zealand. So it's going to come. The Prime Minister talks about it as if it's happened. It's not happened. It's possibly happening, but we need to get much better at actually doing things and getting things done, and that's not happening.
You mentioned that the government hasn't actually prepared that effectively for Omicron. From your perspective, what do you see the consequences of that being, and are you optimistic that we're going to be able to handle this?
Well, it's a replay of what we saw with Delta, right? I mean, we had Delta coming for a long period of time. We saw it in other parts of the world. Earlier in the year, we had a Prime Minister say, oh, don't worry, New Zealand, you don't need to get vaccinated. We're in good shape. We'll leave all the vaccines to the other countries. We were probably 6 months underprepared for Delta in terms of actually our vaccine rollout. So when it hit, we only had 20% of the population double vaccinated. And as a consequence, we put Auckland into a very painful 15-week lockdown because that was the reality of that decision. And so it had huge economic and social and emotional impacts on people. And the same thing's happening here. We're here today doing this process because we're trying to buy time yet again, because somewhere we didn't start boosters before Christmas. We didn't start doing children's vaccinations before Christmas. We didn't order any drug treatments that are actually here. We didn't order rapid antigen testings. And that's what we need to do. So for me, it's like, look, confront the reality, and the reality is we're underprepared. So now what do we have to do? We have to get really, really focused on delivering on those things that will keep New Zealanders safe.
Should the gap between the second vaccine and the third be shortened to 3 months as happened in parts of Europe?
That's really a decision for the government based off the health advice and the experts that we have that will advise us on that. And so at the moment in New Zealand it's 4 months. I appreciate in other countries it's 3. But that's a conversation that you'd want to be having, and reassure yourself with your health professionals is should we be at 3? Should we be at 4? What's your advice? What's your expert advice given the situation we've got? So we have to we have to respect and take health advice from our experts, but that would be one of the questions I'd be asking. We'll look into that. We're just digesting as to what's happening and what the implications are for us. I've cancelled all my meetings in Christchurch tomorrow, and so we'll look at that in the coming days. All right.
Prepared for this? I guess it's scary moving into any new phase of the outbreak. But when you heard this today, how did you personally feel about it? And do you feel like you're personally ready?
Well, look, I've been a big fan of vaccination right from the get-go. I had a family member working in MIQ, so my family and I were double vaccinated back in April. Interestingly, when my 6 months came up at that time, we didn't have any boosters, so I've had to wait until I've got boosted, which I've duly done. So, I feel like I've taken as much personal responsibility as I can around masking and all those sorts of things. But what I'd say to you is I don't feel the country is prepared, and I appreciate people are going to be worried. Some people, there's a range of feelings in the country, but bottom line, we would feel much better if we have those defences in place and are well resourced and actually happening. Awesome. Take one more question, otherwise we can. Yes.
Should masks be free? Should masks be supplied by the government to people who need it?
Oh, look, I think masks can be freely available. How people get hold of them and how they're funded is a secondary question in my view. I'm just worried about what I'd really like to know is how do we get rapid antigen tests to as many New Zealanders as possible? How do we get the boosters done? How do we get into those vulnerable communities? How do we get to our seniors? Those are the big questions that we've really got to get into.